All right. Hello, everybody. Welcome to the Flint Community Webinar on coronavirus. This is week 76. Who knew back in 2020 that we would be 76 weeks in? But I just am thanking God for this platform and this forum and all the people who participate and make it possible. You know who I am. I am your webinar host, Yvonne Lewis. No, I'm just kidding. Go to the next slide. Yvonne Lewis, I've been waiting to give that joke all week. Yvonne, our wonderful host, is on a mandatory week with her family and her wonderful grandchildren. And so I'm just filling in her place. But Yvonne set everything up the way she always does. So we're in good hands and we got some really great conversations planned. I just want to acknowledge that this is only possible because of all of the many organizations that work with us and support the work and lift us up, including our hospital partners, community partners, the Health Coalition, the universities, the CBOP Serve. So many people help to make this thing go every week, and we just want to acknowledge and appreciate those folks. I want to jump right in. We've had a lot of exciting things. We had the FDA approved the Pfizer vaccine. And I know a lot of people have been on the fence. I don't know, this emergency use authorization, Operation Warp Speed, pauses on vaccine, all that stuff has given people a lot of concern. And I have heard from a lot of people that having an FDA approval would make a difference for them. So now we have that. So we want to talk about that a little bit. We got some experts here to help us do that. We want to do a little bit of unpacking because what we want to do is make sure that people are empowered with knowledge and are able to use that knowledge to make good choices about how to keep themselves safe. Our great colleague, Gary Jones, is normally with us every week. He's not here this week, so we won't have our normal update from the governor's office, but you will be able to hear from some of our other panelists about what's happening both in Flint. And then we've got a real treat because we've got Nurse T. Tarnisa Martin is with us. You might know her as Flint's favorite nurse, Nurse T, and we're our panelists. And just, I want to ask a few questions. We just heard about this FDA approval. And I'm going to ask Dr. Wolford, Dr. Reynolds, Nurse T, Sherelle, yes. Dr. Wolford, what does the full FDA approval mean?
So
what does
this
that
is
mean?
wonderful news. Thank you so much, Dr. Deborah. It's wonderful news. We knew that many people were, as you say, concerned that maybe just having the vaccine wasn't completely safe. But what the full approval means is that the FDA has had the opportunity to review a mass of data. We have hundreds of millions of doses of this vaccine that have been administered across the world. And they've been able to look at those data and they can say that these data show that the vaccine is safe and effective. So as you mentioned, if people were waiting for this, now it has come. Secure in moving forward and getting the vaccine.
Yeah, I have had a lot of conversations with people about this, and I'll tell you, I had some problems with a lot of the names and a lot of the ways we communicated things, right? We named this whole thing Operation Warp Speed, and when I hear warp speed, I'm like, do I want something injected in my arm that was developed at warp speed? I don't know. And then you couple that with an emergency use authorization. This is an emergency. An emergency, you'll bumper stickers and bubblegum, so then we hear all of these things. And I always tell people that the emergency use authorization is a level of regulatory control. It's not just, sort of anything, but the full FDA approval does mean a lot. Can you tell us what, because it's my understanding that the full FDA approval means there's substantial evidence of the medication's effectiveness, that it does what it says it will do. And I think we've had a lot of COVID vaccine can and cannot do and does not provide. Can you say a little bit about that?
I'm so glad you raised that point. because this full approval says two things. One, that it does what it says it can do, and two, that it's safe. So in regards to that doing what it says it can do, we know, many of us will remember when the first results sort of came out about the testing for the vaccine, we heard that, starting with Pfizer, that its efficacy was like 95%, much higher than we get with flu vaccine, which is usually somewhere between 40 and 60%. So this was very high. But note, it was not 100%, because no vaccine is 100%. So even by saying that it was 95% effective, we knew that there were going to be some people who got the vaccine who were going to get sick, right? That we knew that. It was going to be a very small number, but that was going to happen. So now when we see that happening, when we see some people getting sick, we shouldn't think to ourselves, oh, the vaccine is not working. We think to ourselves, oh, we knew some were going to get sick. Is it more than we expected? Are they getting sicker than we expected? Are people actually being protected by the vaccine? And we know they are, because all of the data shows that when we look at the people who are getting hospitalized and who are dying from COVID, it is in large part people who have not been vaccinated. So we shouldn't be thrown off when we see some people who have the vaccine getting sick. We shouldn't even be thrown off when we see some people who get the vaccine actually ending up in the hospital. We knew that would happen to a small number. What we should be heartened by is the fact that the vast majority of people who get the vaccine are so well protected that when we look at people who are hospitalized and who are dying, it is largely those who are not vaccinated.
I got it. I want to pick up on one thing you said. You said the flu vaccine is typically somewhere on the order of about 40 to 60% effective.
I mean, it changes year by year, right? As we try to, because we're trying to guess with the flu vaccine what strain is going to be the most prevalent one in our area, well, the most common one in our, but it's still worth getting, because it still protects us to some extent. It still keeps many of us out of the hospital and most of us from getting it. So it's worth getting. These mRNA vaccines are so very effective that in a way we have somehow caused people to think that, oh, if you get a vaccine, it's like a force field around you and no one will ever get sick. That's not what it is. It is one of those layers in that Swiss cheese layer that Dr. Reynolds tells us about frequently. It's one of those layers, and a really important one to help us stay protected.
Okay, wonderful. Thank you, Dr. Wolford. If you have any ideas, or you got a bowl of M&Ms or something that you need to demonstrate to us, we always
bring
love
the Swiss cheese.
We'll bring Swiss cheese next week. We're gonna have Swiss cheese.
Maybe next week you might have to bring some Swiss cheese. I love it. Okay, so Dr. Reynolds, Dr. Wolford touched on something. She talked about the flu vaccine. Now, I've been hearing that the flu season, they say, is going to start a little earlier this year. I think there's some interesting parallels here. So people say, well, if I got the COVID vaccine, do I need the flu vaccine, and why? And when should people be getting that flu vaccine?
Most definitely. I just got my email from my pharmacist that the flu vaccine is available now. So you should check with your pharmacy chains and your physicians to see when and where you can get a flu vaccine. And sometimes all you have to do is schedule an appointment online, pick up the phone. It's important because it cuts down on your risk of having to go to the ER if you just have symptoms that someone might confuse with COVID. It's good to know. Once again, not 100% foolproof, but you need another layer of protection, and that is to continue with your routine immunizations. So my plan is to make my appointment next week. And don't let anybody tell you it's too early because the vaccine only lasts so long. But you should get it now because we got to deal with today. We can't deal with 6 to 8 months from now. And that comes to the point of boosters. for the COVID-19 vaccine. It has been approved for immunocompromised people. That means people under treatment for cancer, whole organ transplants. Sometimes I wonder why they didn't include family members thereof, but what I do recommend is, well, I'll say what I don't recommend is don't go to the pharmacy and lie about your status because there are people who need it. And sometimes there's repercussions of you providing false information, i.e. it goes on your insurance record and may increase your insurance rate and create other problems for you. So it always pays to stick to the truth and look out for your loved ones and make sure they get their boosters. At some point, they'll start talking about people my age, 65 years of age and older. They already have extended care facilities. So that's important. So you have to keep attuned. And unfortunately, sometimes the media gets ahead of what's actually going on, and they leave us standing flat-footed because we're saying, yes, the booster is coming. Yes, the flu shot is coming, and it's not necessary. It is coming, but it may not be today or tomorrow. So we have to really consider the source. And once the FDA gets makes the opinion and the CDC gives the clearance, then things will get going.
Okay, so even if you've had the COVID shot, you still need the flu shot, and you don't recommend that people self-prescribe that booster
That is
shot.
absolutely correct. And may I say something else about self-prescription? There's a Wisconsin Senator, Ron Johnson, who had been advising people to take a medicine for parasites in livestock as a mixture to prevent COVID-19 or early treatment for COVID-19. And there are people who have done so and have had problems. These medications were being purchased at farm supply veterinary places, and they were dosed for animals that weigh 1 ton. So you can easily overdose. This senator has been banned from YouTube. The FDA came out with another statement that this is unwise. And the reason I bring it up is because people are always saying, well, I don't know what's in the vaccine. I need proof. Well, we do know what's in this medication that is given to cows for parasites. And we do know it's not approved for use in humans. And we do know, except under very rare circumstances in a formulation for humans, it's not appropriate for humans. So we have to, but on the other hand, they say what some ill-advised person says on YouTube, and he's a US Senator. And let's not talk about our colleagues down south. This is an up north guy from Wisconsin. I hate to be so blunt, but let's not be fooled. Check with your doctor, check with the FDA website, check with the CDC website, check with your county health department and your state health department, and always consider the source. And you know, we got some folks like that in all communities, so places you check, and check with Dr. Walford.
I got it. And Dr. Reynolds, because you mentioned it, you mentioned the ingredients in the vaccine. I had a great conversation on AOK radio in Atlanta about the ingredients in the Pfizer vaccine. Because I do want to acknowledge, I think it will tip the scales for some that it's FDA approved. And then there are some for whom it won't tip the scales. And this issue of what is in the vaccine has come up a lot. And I tell people, the ingredients of the Pfizer vaccine and all of these vaccines are available on the FDA website. It is required that they be published, and they be published in the public domain, and that people be able to look at them. And so I want to put the link up in the chat for people, anybody who's interested in knowing what the ingredients are. And it's interesting because if you look at what the ingredients are, now I'm not going to try to pronounce these things. It's not that many, but it's funny. It's called, the first thing is mRNA, lipids. And okay, I'll say the science word. You give me the lay term. Lipids. What are lipids? One of the docs.
Lipids are fats, and it's a layer that they put
Fats.
around
It's
the
fats.
mRNA so that it'll last longer and get into your system.
Yeah, I tell everybody it's the mRNA is very weak and unstable, not really designed to be out there in the streets called our body by itself, and it needs a ride to get to the cell. So it's wrapped in a big fat bubble. And then they tell you a couple of the lipids. Cholesterol, which is another kind of fat. And then there's potassium chloride. Sodium chloride, that basic sodium phosphate. What are those things?
Those are stabilizers. They also adjust the acidity of the solution. And we have potassium in tomato juice. Uh, we have these things are sometimes added to other food products. And I have to digress. And please don't ask me the ingredients of what's in a cigarette. Don't ask me what are
Oh
the
no.
ingredients.
We need 5 of these webinars just to run them
Yes,
all down. These are stabilizers and mostly they're salts. This is really funny. I'm trying to point to something. We got some mRNA, some fats, some salts, and do you know the last ingredient in the COVID vaccine? Sucrose. What is sucrose?
sucrose is a sugar.
It's sugar. So the COVID vaccine is some mRNA, couple fats, couple salts, and
And
some
less
sugar.
sugar than a pop. So let's not talk about we don't want no sugar. And it's less
Yeah.
salt than in spare ribs. And you know I love me some spare ribs, but let's be real. And I ask my
Yeah.
vegetarian colleagues to forgive me on that one.
Yes. You can make collard greens, and they got these faux ribs now. You can make.
Another
We'll do
show,
that on
yes.
another show. A whole nother show. We'll do that. So my point is this: I want to just, for anybody who's on the fence, and I do believe knowledge is power. This question around, well, I have egg allergies or I have da da da. I remind people the way we used to have to make vaccines is we would first have to figure out how to grow the virus so we could figure out how to knock pieces of it out so it wouldn't do harm to people. A lot of times they did that in chicken eggs and hen eggs and things like that. So people with egg allergies might have some sensitivity to those old school vaccines. We're not using any of that technology anymore. We've got mRNA wrapped in fat, a couple of other fats fats to help with the ride, a few salts and other stabilizers to stabilize the molecule, and a little bit of sugar. That's what's in the pinch. That's what's in it. We've got evidence now that it's effective and does what it claims to do, and it's safe. Nurse T, you're the one in the community. People are confronting you with these questions. They trust you. We know how important and powerful the voice of the trusted, credible messenger is in these times. What are you hearing from people out in the community? What do you think we need to be thinking about or doing as a medical or public health community to better support people like you and people in the community?
So out in the community do have a lot of challenging questions. The one thing that I do is every challenging question that comes, I'm not judgmental and I listen. Like I've heard things like they were spraying COVID, like how everybody caught COVID is because, there was a helicopter and they were spraying. And so that conversation is kind of different, but listening to how the community feel is key, and then talking through the strategies and the knowledge base of that conversation. So it's like I went back to a bug spray. Think about a bug spray. When a bug spray sprays, eventually the bugs that is spraying, it eventually dies. So I was trying to explain, like, think about it. If they were actually putting COVID in the air and spraying it so that we will all get affected. Just about every other day or every other couple of days, you would be stepping over bodies because it's airborne and droplet, and addressing it that way and just listening. And then another big concern was about the medical conditions. The community was saying, well, nobody cared about us when we had diabetes, but now it's a big fuss about us getting vaccinated. They're trying to inject something in us and kill us. So it's just basically just answering the questions, being transparent, and focusing on what the CDC guidelines have to say, and just taking the time to have those one-on-one conversations. To piggyback, I can say that the vaccination is safe and effective. A little bit of transparency. Ones end up going to the medical center, and they gave me permission to share this story. So they called and they shared some symptoms. So I immediately directed them to go to the medical center. They had their vaccination. They went in, they was there, they was assessed, and they were sent home. They were told that they had a mild case of it, meaning that their oxygenation, they didn't require oxygen. So at the end of the conversation, they did have the vaccination, because the vaccination did exactly what it was supposed to do. It protected. Otherwise, this individual would have had a worse outcome. And now they're at home doing well. And one big thing that we're pushing at the medical center is making sure that you're safe and effective, especially with masks. I notice a lot in the community that people are wearing shields like this, thinking that it's a form of protection, and they're not wearing the mask. So just making sure that we're reinforcing that if you're going to wear the mask, which masks are, recommended, make sure you wear a mask correctly, and that you don't try to replace the shield. When we go in and we take care of patients, we actually have on an N95 or a procedural mask and a shield. But I see a lot of the community members just wearing shields. And I know that they were saying that it's okay to wear a shield if you're compromised, but making sure that, and then hand sanitizer, making sure that they check the expiration date. I've been doing a lot of education on the expiration date because hand sanitizers expires. So it's just the simple things. As far as our ED updates, like 10 to 20% of the patients that's coming into the ED are vaccinated. So we have low numbers. On an average of seeing maybe 100 patients, maybe 2 out of every 10 patients is vaccinated. So we're out there really pushing it, and just staying transparent and staying connected to the community is key.
All right. Well, Nurse T, we appreciate you. I want you to, I'm going to come back to you when we get toward the end. I want you to think about, as you hear some of the numbers and the other things that are happening, if there's any other updates you want to give us from the perspective of the hospital, we will come back to you, and we'd love to hear those. I've been at Hurley. I told y'all my granddaughter was born yesterday at Hurley at 7:23. And so it's interesting to see the protocols. We could only have 2 people, but only one. You can't, once you put those 2 names down, you can't change them out. They're really trying to limit who's coming in, and then they're requiring, and I thought this was really cool, they're requiring that everybody in the hospital have on a mask. And I was walking out of the hospital, and I saw 2 people coming in, and they were unmasked. Somebody stopped them right at the door and said, "Hey, you have to have a mask to come in." Before they could even get any further, they said, "And if you don't have it,
Yes,
we'll provide one for you." It really gave me the chills, because it wasn't about, you never know why people are coming to the hospital. If they're coming because a loved one is ill or dying, or they themselves are, you never know. But I just thought it was so cool that they stopped them immediately. "Don't have one, we'll provide it for you. Do you need us to get you one?" And it was cool. And it was an older couple, and they said, we came here on a rush, and we do need a mask. And they immediately gave them a mask. They had made it no more than about 6 inches in the door. So I'm like, bravo, Hurley. It makes me feel good that my granddaughter is safe, and that the people that are coming to the hospital are also being honored, right? So we'll come back to you, Nurse T, for any Hurley or other community updates. I want to say thank you to all my panelists. Dr. Wolford, any last thing, because you've been listening. that you think is relevant or that you want to leave people with, since we're not getting a Wolford demonstration
Well,
today?
I just want to say that you've really hit on some important points. That vaccine is there to protect us, and it's working well and it's safe. It's been tested in millions of people now. So we have enough evidence to feel confident in its safety. But it's one layer. We need to wear the mask, the virus when it's in our body. But why let it get into the body? Use the mask to prevent it from getting into the body. And if you have it, to prevent you from spreading it. I mean, we could fight off a thief once they get in the house, but isn't it better to have a locked door and windows locked and so on so they can't get in? I mean, use all the layers that we have. And if you have any questions, especially about vaccines for kids and masks for kids, speak with your pediatrician. Your pediatrician wants to get to know you, wants to share helpful information. Speak to your pediatrician and discuss your concerns about masks with them.
Awesome. Even though most pediatricians don't have that great accent like you have, and they don't explain things quite as crystal as you do. But point well taken. Talk to your pediatrician, and adults, talk to your primary care provider. All right. Thank you so much to all of our panelists. We are going to turn it over now to get updates from the health department. And we have Sherelle Brown, who just comes back week after week. Sherelle, are you out in the community? You are mostly out in the community when you give us these updates, right?
Most of the time, but so I'm here in my office.
All right, well, take it away. Let us know.
Thank you. So I do want to mention that vaccination rates are still on the rise. We could see more. So we hope that you guys are getting ready to come out and get vaccinated if you have not been. Looks like over the past week, we've seen an increase to over 334,000 doses to be administered in Genesee County, raising our fully vaccinated residents percentage up to 45.4%. And then of those who are 16 and older, we're at 54.5%. So we still want to see those numbers to continue to rise, but good job. Keep coming. Next slide. We do have clinics, the asterisks that are noted by the Nazarene and Shiloh Missionary Baptist Church are our standing clinics. So we have those every Tuesday, Wednesday, and Thursday. We'll also do a clinic this Saturday, a pop-up clinic. On the slide, that address is wrong. I'll put that in the comments. It should be at Linden Library parking lot, located at 201 Main Street in Linden, Michigan. So we'll be doing vaccinations this Saturday from 1 to 3 p.m. if you can't make it to any of the clinics that we host during the week. We'll have an event at 111 West 2nd Street, Flint, Michigan, from 3 to 5. And at both of those weekend clinics, we'll have all choices of vaccines. So you can receive Pfizer, Mrna, Johnson & Johnson. If you got your first dose from somewhere else, you can come to either one of those clinics and get your second dose. So please do come. And it is important that if you got one dose, come back and get your second dose, and just to get vaccinated, period. There are children, those who are under 12 is coming soon, but until then, we want to keep our children safe, because in the past week, we've seen our trend of new COVID-19 cases by referral date to increase by 4%. So from August 13th through the 19th, there were 330 confirmed cases in Genesee County, and that has increased to 344 between August 20th and 26th. So we're seeing an increase. Cases are not dropping. We need everyone to be cognizant of that and take precaution by getting your vaccine and staying masked up when you're in public. With the new CDC guidelines, we are at high risk for transmission. So it's important that we get our 7-day positivity average down, which is the positive test results from every COVID-19 test performed. We went from 9% to 10.5% over the last. So get your vaccine, wear your mask, and if you are immunocompromised in Genesee County, we are offering that 3rd dose. So you can come to any clinic that we have listed, get your 3rd dose, continue to get tested. We have our sites on the screen. You can come to Walgreens or Rite Aid locally or visit Genesee County Health Center, as well as Hamilton Community Health Network and our 3 churches, Bethel United Methodist Church and Macedonia Baptist Church. I do believe that Bethel has started doing vaccinations as well. So you can call them before you go if you have any questions. And then if you know anyone who is homebound who needs a vaccine, please do give the health department a call at 810-344-4800 or visit our website at gchd.us, and we can figure out how to get them on our list and come to their home to make sure that they're protected as well.
Sherelle, I want to ask you just a couple quick questions, if you don't mind. You said a couple good points. I just want to make sure we got it. You said something about if you got your 1st dose, make sure you come back and get that 2nd dose. Now, it's my understanding that when they did the clinical trials, as an example, they said 95% effective. But that 95% effectiveness was based on the alpha strains of SARS-CoV-2, and it was based on people getting the 2 doses within that defined time period. Is it in fact true that if people do not get their 2nd dose, the effectiveness of the vaccine goes way, way down?
That is true. It's not as effective if you only receive 1 dose. That percentage is based on 2 doses. And then with the different strains, it's definitely important that we finish out the series, because we are seeing a heavier impact by those strains, where if they would have gotten both doses, they would have been more protected and experienced less symptoms or a less severity of the symptoms that they gotten, because people have reported getting COVID after they've been vaccinated, but they also don't report that they didn't come and finish.
So they only had half of they got a 2-shot vaccine, but they only got 1 shot.
Sometimes that is the case.
Gotcha. I gotcha.
Yes.
All right. And now we've got all these great sites that you shared about. So people, if you get the 1st shot of Pfizer, your 2nd shot should be Pfizer, right?
Correct. And that's the same for the 3rd dose as well.
And you can go to any one of those places. And now the vaccine sites, they tell you which vaccines they're offering. So people should have a lot of choices in the community. Could you just go back to that slide one more time that shows the vaccination sites? Yeah. Okay, great. Oh, so you got, if you want to get, you can get Pfizer or Moderna or the J&J, and it tells you by site. All right, so thanks for that. So it has to, people have to get that 2nd shot. And then you said the testing positivity rate has hit that point and has stayed at that point where we are at high transmission risk for the CDC. Just so that people understand what that is, can you just tell us what the testing positivity rate is?
The testing positivity rate is based on how many tests come back positive that are being tested. So if all the tests done, say we did 400 tests and 40 of those tests come back positive, then that's 10%. So
got it. So that means that number going up means more people that are getting tested are coming back positive.
Yes.
So that's one of those sort of early indicators that we're sort of heading in the wrong direction, because earlier in the pandemic, we only tested people who were symptomatic, like that. But now we have community-wide testing. So that numbers are going in the wrong direction. Is that true?
That is true. So if the number was decreasing, but we had that same 400 to come in, then that would mean that less than 40 were positive. So to have it to decrease means that the transmission isn't as high. So as it increases, our transmission rate increases.
All right, wonderful. Sherelle, thank you. We salute you and all of our partners at the health department. We know you are champions and heroes and sheroes of public health, but we stand with you and we really appreciate all that you are doing to try to keep not just us, but our children and those who are not vaccine eligible safe. Sherelle did a great job. I'm just going to quickly touch on a few high level points. I encourage people sign up and receive the health equity brief. These are just a few snapshots out of that. As Sherelle said, based on these CDC risk level metrics, Genesee County remains at high risk for COVID transmission. What does that mean? That means that we have more people who are contracting COVID each week than would be, I believe the metric is over 100 per 100,000, and we have far exceeded that number. The testing positivity rate, when we produced this report, it was around 9%. We just heard from Sherelle, it went up to 10.5%. Guys, we got a problem. Things are going in the wrong direction. Case counts are continuing to increase each week. We wanted to show you what that looks like. We report out on the data every week, the data that we have. And I want to just give you a caveat. We've put these gray cases in, we call them lag cases. It says here recently received. Consider these to be lagged cases. These are cases that were identified, but by the time the test result came back a week or two later, we had already reported out on that week. So it's original. They're based on the data that we have at that time. Sometimes it might take 2 or 3 weeks for the result to come back and to show up in the data. But it doesn't mean that the cases are not in community. So what we've decided to do is to demonstrate for you and show you what that lag looks like. So if you go back to last week, as an example, week 76 in Genesee County, we reported those numbers, the 20, and this week, an additional 87 cases came in for that week that started August 8th and ended August 15th. An additional 87 cases. Remember, cases get counted in the week that the test was taken. You don't get counted as a case when your test result comes back. You get counted as a case when you were actually a case, i.e., when you took the test. So I'd say this to say to people, whatever numbers you're getting week by week, know that the numbers are likely higher even than what's being reported. And sometimes that difference is not small. In Genesee County last week, it was an extra 87 cases. If we narrow down and come down into Flint, last week, there were 16 additional cases that got counted once all that data came in. So you can see the trends are going up. And once we put those lag cases in, the numbers are even higher. So my bottom line here is things are moving in the wrong direction. The case counts are going up. We're getting dangerously close. We've already exceeded where we were last March and April. We're getting dangerously close to hitting that spot where we were when we were at the peak of the pandemic. So the protection and prevention remain more important than ever. The masking, the distancing, and the good hand and hygiene. Catherine Crawford, she's going to talk about some of the policy implications of what's happening in this arena right now. Go ahead, Mary.
Okay, great. So as always, if you have any questions, just shoot me an email, crawf457@msu.edu. So the first thing I want to talk about is this incredible opportunity that policymakers have to boost the state's economic jumpstart. And I want to just kind of give a little bit of background on that, as there are still billions of dollars left in fiscal recovery funds that are sitting. I know we've mentioned this before, but these are funds that have to be appropriated by the September 30th deadline, or they go back to the federal government. So again, we have a $2.1 billion proposal from Governor Whitmer that would go towards growing our middle class, which means lifting more people out of poverty and elevating equity. And not to mention millions of dollars in the proposal that would be allocated toward addressing issues like affordable housing and cleaner infrastructure and job and education initiatives. With so much work to be done in Michigan, this money really should not be going back to DC. We need our policymakers to get a bill to our governor and continue on the road to recovery in getting out of this pandemic. So I encourage you to read the proposal for yourself and take a look at it and all of the great initiatives that have been put forth. That's all linked up in the brief. So hopefully you're signed up. The second thing I want to talk about is this recent citizen initiated ballot measure to strip local to mandate or to implement mandates in the community that preserve public health. So should the petition actually collect the minimum number of valid signatures needed, policymakers would then either adopt or reject the law. So I really want to point out, and Dr. Reynolds really set me up great for this, is that critics of any of this type of initiative are going to include public health officers and even legal experts. And they argue that such a measure is actually going to stop the state and local health agencies to control the spread of COVID. And I also want to point out that not only that, when we have this hard and fast, policy come down the line in the future, right? So this has implications for any event in the future epidemic or other kind of public health crises that then requires the expertise of doctors, scientists, and health officials. So thank you, Dr. Reynolds, for getting me set up for that one, because when he had mentioned what some of our policymakers are up to in the neighboring states, including spreading misinformation and encouraging that individuals take deworming medication meant for farm animals, when these policies try to take power away from experts.
Yes, I'm fired up. Ready to go.
Yeah.
Mary Catherine Crawford. And if anybody wants to get the health equity brief, this issue around the data, the recommendation for policymakers, live links to this legislation. Mary is really doing, I just want to acknowledge you, a really stellar job at combing through everything might be relevant for public health policy. And she's making sure that we bring it forward each week. You get just a snippet of it in the webinar, but the real sort of meat of it is in the health equity brief. So you email her craw457@msu.edu if you want to sign up for that brief. It only comes out once a week. It's a really great resource. And Mary, thank you for the work that you're doing on that. We want to turn it over now to our, I say, relatively new manager of public health for the city of Flint, Kiana Towns. Will dates for us, anything you want us to know from the city, now's the time.
All right, good afternoon, everybody. Did want to say thank you to everyone for the updates today, and for Dr. Wolford and Nurse T. Next week, I'm going to have my visuals together. When I go to the drugstore to get my cadence test, like Dr. Reynolds tells us, I'm going to get myself a poster board and some glue sticks, and I'm going to join this because you all are giving the best visual. All right, here are just a few updates from the City of Flint this week. First up, as you all may have noticed, it may have come out in the news, certainly a press release went out the other day. MDHHS has come into Flint in partnership with Eagle and the City of Flint to help support water testing efforts as we online the secondary water source. So you'll see unity. They are being accompanied by outreach workers from Genesee Health System, and they are collecting water samples throughout the City of Flint. There will soon be updated information on the city's website. And certainly if any residents have any questions, you can call us here at the information desk at 810-410-2020, and we can provide updated information. An update from the Blight team. The Blight department they currently have 5 staff working out in our community. Hiring is ongoing in the Blight department. Has hired additional Blight assistant teams to get out into our community and help to support the cleanup of the blight in our city. The mayor is continuing, or he's wrapping up the ward by ward tour next week in the 6th ward at Durant-Turry-Mott on September 2nd. The doors open at 5:30 and the event is from 6 to 7. Mayor's there to answer any questions residents have. So please and have your questions answered by the mayor. This week, the mayor joined mayors from the Mayor's Commission on Water Equity at the Great Lakes and St. Lawrence Cities Initiative Annual General Meeting on Climate Change 2021 and beyond. Mayor Neely spoke on the lead contamination and the need for Congress to pass the federal infrastructure package. So the mayor is out giving words this week. There is a visual up on the city's web pages and social media pages regarding public safety. So there was an update, I believe, that went out on Monday with the details on the public safety initiatives from the Emergency Act. The City of Flint, finally, the police department is provided an update on the social media pages after receiving complaints from residents in the area of Ballinger Highway and Mackin Road. The police conducted a traffic operation in that area, which resulted in 15 traffic stops. There were 3 arrests during that time, 6 speeding violations, 2 other hazardous action violations. There were 11 other non-hazardous action violations. So the police are out and responding to the concerns of our citizens. And that's the end of my updates. Thank you, everybody.
All right, wonderful. Kiana, I feel like I got a lot of goodies. Thank you, and I'm really happy. I know this issue around folks drag racing and putting people in harm's way, and I don't know how much of it is COVID fatigue and people just getting antsy and just looking for some way to have some frills and fun. But I'm really, all of us safe. And thank you for taking up the mantle as the manager of public health and coming to be with us each week to provide these updates. Thank you.
I am enjoying my time. Thank you for the feedback there.
All right, awesome. All right, Nurse T, you listened, you heard. Anything else you want to maybe give us or provide to us as far as updates from Hurley, updates from community, or things that you really just think are important for this group to know?
I just want to reinforce following the CDC guidelines, staying safe. This does my heart well to see people wearing masks, but it also hurt when people are not wearing masks and they think that they are being protected by wearing the shields. I noticed that yesterday a couple times at a couple of events, and just having those conversations, because they're really trying to be safe, but then they don't know if there's anything that I can stress. Please make sure that you wear a mask and you wear a mask appropriately, and that you know that the shield is just in addition. And if you are compromised, and then use the shield. And as well with the hand sanitizer. just making sure that we're checking expiration dates on everything, because people are using a lot of hand sanitizer. And I would hate for people to be using hand sanitizers and they think that they're doing their part, but the sanitizer has expired. And just staying connected, ask questions, know that no question is too big or too small. If we don't have the answers, or if I don't have the answers, I'm tapped into a large health care system. And far as Hurley Medical Center, we're just continuing to follow our CDC guidelines. We're staying safe. We're wearing masks. As you mentioned, our visitor policy, we're staying up on that. And we're just hoping to get more of our patients in our community vaccinated. A large percent of our patients that's coming in, they do have a lot of comorbidities. And a lot of times it's not the COVID virus, it's them having diabetes or COPD. And, you know, our top three now is respiratory, COPD, and sepsis, which all can be because it triggers that stuff. So just be safe, be inspired, and thank you for the platform.
Okay, and then Nurse T, before we hand it over for the next to last word to Dr. Reynolds, I'm over here a little uncomfortable in my seat. You said the face shield ain't enough. The face shield is cute, but it ain't that's not the CDC recommendation. I'm not protected with that.
No, you're not, because there's no seal. And so a lot of people are wearing these because they're cute and they're trying to be, you know, bougie, as they say, or out there being fine. But this is not a protection. When we're not.
But what happens when I put my makeup on and I put my pink lipstick on and then I put the mask on, it rubs all off. So I put my face shield on to try to, you know, stop the spray from coming out. You saying that's not it? That's not enough.
Just put on some Carmex. Put on some Carmex. Put your mask on. Make sure that you have a seal here and here. You gotta have a proper seal. And then when you cough, because when you cough, it's here and it's being protected. And a lot of times too, your hands. When we're coughing, a lot of times people will cough in their hands and then they may not sanitize or get to wash their hands right away, and then it just goes right in the face. When you're coughing, so we just have to be safe and effective and use what's, you know, protocol. Now, if you want to do this is how we look cute in the medical center. This is my fly.
Nurse T, I feel like with you, I can't have nothing.
You can, but just think about it. At least you be safe.
Okay, I got it. So if we want to be cute, we can just wear the shield. If we want to be safe, we have to wear the mask.
And now, if you are immunocompromised or you have some to where you can't wear, this is a better than nothing. But
it's better than nothing. But that is really for people who are really not able because of some medical condition to wear, medical or other condition. Because I have also seen some of our Muslim brothers and sisters, some who are fully covered, you know, and they have things that cover, maybe doesn't cover their nose, but it covers their mouth and I've seen them in face shields. But you're saying the face shield is only line of protection. It is only for people who have a medical rationale for not being able to wear a mask, or some other, you know, religious or whatever reason that maybe their mouth is covered, but they can't, you know, wear a mask. But you're saying the face shield by itself is not enough.
What the face shield is protecting is your eyes. So when we go in the patient's room, or if we go in the patient's room that do have COVID, we wear N95s, but we'll have an N95. We'll have on gowns, gloves, our eyes. Even on top of my glasses, I had to wear an eye shield. So the eye shield is protecting our eyes. So when they're out there in the community being cute, they do look cute. I mean, but being cute is not going to keep you safe. And I want you to stay safe.
I gotcha. Okay. All right. So, all right, I got it. leave my lipstick at home and wear my Carmex, and I'll spray a little all-nighter to fix my face powder and face so it won't rub off on my mask, because I guess I don't have protection.
And don't forget to check the expiration dates.
And check the expiration dates on my hand sanitizer that aren't expired. All right, Nurse T, the bearer of the good news, bad news, the real news. Thank you so much. We really appreciate you. All right, Dr. Reynolds, I'm gonna give you the almost next to last word. What do you want to say? How do you want to close us out? Bring it all back.
I'll say a smart doctor always listens to their nursing colleagues. And moving right along. Today, getting the right to vote. The 19th Amendment was ratified August 26th, 1919. So look, y'all, vote. If you're not registered, get registered. If you know someone who's not registered, take them to get registered. Your daughters, your nieces, your nephews, take them to get registered. And if you have a trifling male friend, take him to get registered also. So please, those rights were won, and everybody talks about the suffragettes, but Mary Church Terrell, Frances Ellen Watkins Harper, and many of the Black sororities who were out there pushing for women's votes. So please honor their effort by registering to vote and voting, because that's how we determine the budgets for our health departments, for our hospitals, for our medical school, our nursing schools, and all the other health professionals. So remember that. Thank you.
All right, Dr. Reynolds, thank you so much for that. Thank you for local pediatrician and historian as well. I appreciate it. So because of what
I have the Equal Justice Initiative calendar, and every morning I wake up, I have to find out something. So look it up. All right.
Power to the people, my brother. Power to the people. So to honor Nurse T, I'm gonna put my mask on and my because I had bought me a couple of these real cute face shields. See how cute that is? And then I even had one Nurse T that's tinted. So I'll make sure that when I got my face shield on, I'm doing it with my mask on as well. Okay? That's the deal. All right. So anybody who wants continuing education units, we have them available for community health workers and for social workers. Why? Because you are the ones out on the ground floor. You are the ones interacting with people. And we know that there's been lapses in the ability to earn these continuing education units. So I really want to thank our partners at Michigan State University. If you attend the webinar units, any questions, our own Mary Catherine, who does our health equity brief, will help you. Croft 457 at msu.edu. We are closing out now. I recommend, please like us on Facebook, subscribe to our YouTube channel. You go to YouTube, search for Healthy Flint. You can find us, click follow. All of this stuff is memorialized there. If you like it, share it with friends, share it with family. As always, email us info@hfrcc.org. And you can always call us at 810-835-2130. And won't be me, it will be our normal moderator, the wonderful Miss Yvonne Lewis, taking a much needed and well-deserved week with family and her grandkids for week 77 of the Flint Community Coronavirus Webinar. Thanks, everybody. Be safe, and we'll see you next week.